Dr. Hyde is going to do the next presentation. He's a first-year resident. And, whoops, I'll go back and let him go through that.
Alrighty, how's it going, everybody? So again, my name is Christopher Hyde, if I haven't met anyone yet. I'm a first-year resident, like Dr. Freed said, and I'm heading up to Northern California to finish radiology residency in a few months. I have no disclosures, but I do have a myth I'm pretty excited about. Hopefully we all learn something. Maybe have some fun too. Oh, wait, that's the wrong presentation. That's next week, sorry. All right, medical Mythbuster. We're back. So, just some background. I think whether we are early on in our medical careers or well into it, I think we can all recall when, family and friends really started to lean into the idea of having a doctor at home, right? It seemed like friends, family took any opportunity they could get to get some free medical advice, even if we were, still in medical school. Got to get what you pay for. Seems to happen during family reunions. I was ready for this though. I'd heard about this phenomenon. I was excited. Just like everyone else, I studied. I thought about, what could they ask me at Thanksgiving dinner? I thought I was prepared. Aunt Marge stood up and said, "Can someone please draw the brachial plexus?" Got it. No problem. Uncle Jim, just frantically searching for the third step in the Krebs cycle. Easy, right there. I can tell probably none of us have remembered any of this because that's not even the Krebs cycle, that's photosynthesis. So, but it's all right. That's tough. We're still working on that. But instead of those basic science questions, we seem to get a lot tougher ones, a lot more nuanced ones. Questions that I encountered pretty frequently were things like, why does my shoulder do that weird clicking thing? Right? Or, does this look suspicious to you? That one's always a good one. And the topic of today's discussion is, am I really not allowed to drink alcohol on this? So that's the myth, is drinking alcohol while on metronidazole causes a disulfiram-like reaction. I think we've all heard something similar to this before. So, as is tradition, medical Mythbusters, it's often helpful to go back to the beginning to see how we got here. Disulfiram, or branded as antabuse, is often seen as a second-line agent for alcohol dependence behind acamprosate and naltrexone. In 1881, a very smart gentleman first synthesized it. In 1930s, it was Mr. E.E. Williams who first documented an observation where he noted that his factory workers who processed the chemical seemed to get sick after ingesting alcohol in their breaks. But it wasn't until about 10 years later or so when Dr. Jacobson chelated disulfiram with copper and found out that it's a pretty dang effective vermicide. And I guess as many notable scientists, Dr. Jacobson had a habit of trying his own concoction on himself, and he realized, quote, disulfiram tablets really changed the effect of alcohol in a most unpleasant direction. So how does disulfiram work real quick? I think we all remember. It's the basic metabolic pathway, kind of what our body does to alcohol. It's a two-step process converting ethanol to acetaldehyde and then further to acetate. And if we see here, disulfiram works on the second step, aldehyde dehydrogenase. It's an irreversible binder, and when it does so, it increases the concentration of acetaldehyde. And that is the metabolite that seems to cause all those unpleasant symptoms. It's pretty well documented with disulfiram. When given in the setting of alcohol ingestion, blood acetaldehyde levels can increase by 5 or even up to 10% compared to just alcohol without disulfiram. And even Rossman and friends showed that disulfiram has the ability to increase acetaldehyde levels by 30 or 40%, even in abstinent alcoholics, so people who aren't actively drinking. So just a quick recap as well. What are the symptoms of a disulfiram reaction? I think one of the cardinal symptoms is flushing, for sure. Headaches, nausea, vomiting, palpitations. I think you guys can tell I'm really into stock photos. Oh, even more, twice. Nice. So metronidazole, how did metronidazole get caught up in this mess? Right. Well, it seems to have started from some key observations and case studies, which is similar to how many big discoveries begin. So in 1964, a single case study came out arguing that metronidazole may be effective for alcoholism based on about 50 patients who reported reduced desires to drink and disulfiram-like reactions, suggesting a similar mechanism of action to disulfiram. And in fact, if you look at a lot of the reports and a lot of the evidence for this drug-drug interaction, they all seem to cite a common 5 or so studies that seem to be the foundation of all the claims that metronidazole likely inhibits this same enzyme, aldehyde dehydrogenase. In 1980, though, Edwards and friends proposed that metronidazole's mechanism is an inhibitor to hydrogen production, serving as an electron acceptor in redox reactions that crosses membranes of anaerobes more than it does aerobes. So if we take a closer look at those 5 studies, it's a lot of, I didn't want to go through each one individually, but just to break them down pretty quick, there seems to be some commonalities that are notable here. The first is in all these case reports, there's many confounding variables. Participants in all these studies were taking multiple medications, not just these 2. And those multiple medications, some of which were hepatotoxic. The amount of alcohol that was consumed was never standardized. Some had very few drinks, some had many drinks. In pretty much all these as well, there were very few participants, or very few. The case study was, an N of few. The definition of a disulfiram reaction for these studies are different. And of course, the time of onset when they get symptoms, and even the time that symptoms resolve after stopping metronidazole is different. And of course, just being case reports, there's nothing wrong with case reports, but these weren't, the classic double-blind, controlled, randomized trials. But fortunately, in, early 21st century, beginning in 2000, 2 new studies came out looking actually at acetaldehyde levels in vivo, which is pretty sweet. One was in rats, and one was in people. More stock photos. So the first one I'm going to talk about, a little bit chopped off, but it's okay. Metronidazole increases intracolonic, but not peripheral blood, acetaldehyde in chronic ethanol-treated rats. So the basic methods for this study, they took a group of rats, divided them into 4 groups. One received nothing, one group received alcohol, one received metronidazole, and the last lucky group received alcohol and metronidazole. And they measured both blood and intracolonic levels of acetaldehyde and alcohol. And the results, we can kind of walk through these. If we look at this first graph on our left, these are the acetaldehyde levels in the colon, with our 4 groups along the bottom, first being the control, or nothing. Second one being control with metronidazole, or just metronidazole. Next one over is ethanol, and then that big jump we see is when ethanol and metronidazole are combined. There seems to be definitely an increase in acetaldehyde in the colon. However, when they tested the blood, they found that ethanol levels in groups E and EM, so alcohol and alcohol with metronidazole, showed no statistically significant difference in acetaldehyde levels or alcohol levels. So basically insignificant p-values right there. That's probably pretty interesting. The Next study actually came out a couple years later in 2002. Apologize again, it's kind of chopped off at the top. But the title is Lack of Disulfiram Reaction with Metronidazole and Ethanol. And this one was done in humans, not rats. And this one was a randomized, double-blind, placebo-controlled prospective study. It did not have a ton of participants. It's only 12. So they split them up in two groups. Half received metronidazole, pre-treated with placebo, and half received half received alcohol after being pre-treated with placebo, and the other 6 received alcohol after being pre-treated with metronidazole for several days. And at the end, or upon the administration of alcohol, both alcohol and acetaldehyde levels in the blood were measured every 20 minutes for 240 minutes. At the same time, vitals were taken, and a questionnaire was filled out every 20 minutes, documenting the symptoms that the participants were having. So this is kind of a summary of the results here. We start on the left side. We have blood ethanol level, the black line being the metronidazole receiving group, and the white line being the placebo group. You see there's no real statistically significant difference in the blood alcohol level over time. And also blood acetaldehyde level, kind of highlighted in yellow there. Blood acetaldehyde was not higher in the metronidazole group than in the placebo group, nor were objective or subjective signs any more prominent in the metronidazole treated group. So in taking vitals every 20 minutes, there didn't seem to be much of a difference. And in the questionnaire that was filled out, there were no difference in reported symptoms. And so this is a summary of the objective signs here. Here we have blood pressure. All those confidence intervals are overlapping. And all those confidence intervals are overlapping as well. And facial temperature, same thing. And interestingly, another study was done. This one was in vitro, not in vivo, but this was looking at secnidazole, which is another medication in the same family as metronidazole. And with this study, they said, in addition, there was no identifiable evidence of time-dependent inhibition of ALDH2, which is the aldehyde dehydrogenase enzyme, by secnidazole. This one used a lot of, I think, gas spectroscopy or gas spectrometry. I'm very rusty in that. But furthermore, there was no observed metabolism or inhibition, which is also known to mediate alcohol-drug interactions. So they were arguing that alcohol and secnidazole did not have a clinically meaningful alcohol-drug interaction. So, in conclusion, disulfiram has a well-documented mechanism of action, acting as an irreversible inhibitor to aldehyde dehydrogenase, causing a buildup of acetaldehyde. It seems that many of the warnings for drug interactions between metronidazole and ethanol seem to be based off of just a handful of case reports. But newer studies in the 21st century actually looked at blood, alcohol, and acetaldehyde levels and argue that metronidazole has no direct effect on these levels in the blood or ALDH activity. And this is the one about secnidazole. Other medications have shown similar data. So, what do we do with this information? I don't think anyone's going to go out, if you subscribe, I don't think anyone's going to go out and recommend friends and family to drink lots of alcohol when taking antibiotics. But, if you have a patient that presents to you with what seems like a disulfiram reaction and they were reportedly drinking alcohol and antibiotics, maybe it is helpful to take pause and explore other causes of possible GI or hepatotoxicity. Maybe do a thorough medication reconciliation to look at other potential drug-drug interactions. And kind of just to go back to the antabuse slide for the symptoms, back where we all started, we could ask ourselves if we see a patient who we're concerned about this, You know, could it be a disulfiram reaction? They're having flushing, headaches, nausea, vomiting, palpitations. Definitely. Could be. Could it be alcohol intoxication? Maybe. Could it be metronidazole toxicity? Maybe. Or perhaps is there just another unaccounted drug-drug interaction causing unpleasant symptoms when you combine these two substances? And that's really not similar to the disulfiram inhibition of aldehyde dehydrogenase. Those are my references.
Okay, that was great. I think this is kind of a classic Mythbuster, you know, where literally a handful of case reports really led to a change in clinical practice for decades. Everybody's been taught, I think I was taught this, you probably all been taught this, or at least heard this at some point in our training. So I think we need to be a little bit skeptical of case reports. It's not that we should ignore them, but I think I'm not sure that it deserves necessarily to change our entire practice based on a few case reports. Not sure what else to say about that. Anybody have any other comments? Dr. Jose.
Yes, so with the, I believe the question was, has anyone looked at acetaldehyde levels in people, in their blood, who've taken disulfiram and alcohol? And yes, the question, or the answer is yes. Following, when disulfiram came out, there were several studies that where people were given disulfiram plus alcohol, or alcohol and not disulfiram, and they compared and they saw, I think it was in one of my slides, significantly increased acetaldehyde levels, not just alcohol levels, but acetaldehyde levels. And that was an argument that they made, that buildup of that metabolite is perhaps what's causing the unpleasant symptoms. Yes.
Any other questions or comments? Dr. Jose again.
I'm guilty of this because I tell people all the time. And it's I think I shared one.
I think it's tough, because I would be willing to bet most everyone can recall either a personal experience or an experience of a friend or family member similar, oftentimes not with metronidazole though, even an entire different class of antibiotic. And it seems to be a lot of anecdotes and, I swear this happened to my friend. But yeah, I've heard that as well, and again, I don't think the point is to go out and tell everyone to drink a whole bunch of alcohol, of course. Yeah. What do you make of? Yeah, so the question was, what do I make of the increased intracolonic acetaldehyde levels? Because those seem pretty statistically significant in the rats. And interestingly, there was some more data which would be nice to show as well. They actually cultured out the flora in those rats and found that in the rats receiving metronidazole and alcohol with the higher acetaldehyde levels, those rats grew out far more Enterobacter species, or alcohol dehydrogenase producing bacteria, and far less anaerobes. Whereas the other group that did not receive metronidazole grew out far less Enterobacter and less bacteria that produced, or that create the alcohol dehydrogenase, excuse me. So one of their arguments was perhaps the GI upset, which seems to be seems to be real in many people. It's not so much related to a disulfiram-like reaction, an increase in acetaldehyde levels, but perhaps a disruption of the gut flora, where you've now allowed bacteria that make aldehyde or alcohol dehydrogenase proliferate. But
Okay, so I think it's time to vote. So, is it a myth drinking alcohol while on metronidazole causes a disulfiram-like reaction? How many think that this statement is true, confirmed? How many think it's plausible? How many think this is busted? Unanimous again. Okay, you have the honors. Just